According to the Centers for Disease Control, exposure to so-called forever chemicals can make people more at risk for COVID-19. That is just one of the new concerns among thousands of people who drank contaminated water at a former Air Force base in Portsmouth, New Hampshire.
PFAS is a class of chemicals found in everything from household products to firefighting foam. The compounds have been linked to a number of health problems, including cancer. Earlier this year, federal health officials launched a first-in-the-nation study into the long-term health effects. That study is on hold, though, because of the pandemic. And as News Center Maine's Vivian Lee reports, there are worries the delay could affect the results.
Worrying about her family's health is always on Andrea Amico's mind. Two of her children and her husband drank water laced with PFAS chemicals at the Pease trade port. Her children were exposed at one of the daycare centers located on the former Air Force base.
I've always been worried about their exposure to PFAS and what that means for their health in the long term. And then now facing COVID, those concerns have only been more elevated.
According to the CDC's Agency for Toxic Substances and Disease Registry, studies suggest exposure to high levels of so-called forever chemicals could suppress the immune system and increase the risk of getting the virus. Studies have also shown that exposure to PFAS could reduce the effectiveness of childhood vaccines.
We have to try to learn not only about PFAS, but how PFAS and COVID intersect.
The industrial chemicals were in firefighting foam used in training exercises at Pease, which seeped into the drinking water supply. Amico and other moms fought for more than 5 years to get our federal health study into the long-term health impact. The chemicals have been linked to a number of health issues, including kidney cancer and thyroid problems. The Pease community will serve as a model site for a national study. Federal investigators had just set up an office at Pease to begin screenings of adults and children who drank the water on base between 2004 and 2014 when the pandemic hit.
We don't have clear answers yet from CDC and ATSDR as to when the study will reopen.
Now, recently, federal funding for the study was boosted to $15 million to cover the cost of the delay and to make sure it can continue safely in the future. Now, Amico believes the study can resume with extra precautions to prevent the spread of the virus, and she's also advocating that participants undergo COVID and antibody testing as well. Federal investigators need 1,000 adults and 350 children who were exposed to PFAS and about 200 who were not exposed to participate in the study. Only 25% of that number signed on before the study was paused. Amico says the delay could impact the results.
We're already 6 years out from when our contamination was discovered, and we're trying to do a health study now, which is better late than never. But if we keep kicking this can down the road, I think it's going to impact our results.
Important answers not only for Pease, but for other communities across the country grappling with a growing PFAS contamination crisis. Vivian Lee, News Center, Maine.
The CDC has not announced when the Pease health study will resume. Recently, New Hampshire Senator Jeanne Shaheen introduced legislation that would create educational courses for physicians to better understand the health consequences of PFAS.